just state your name and your institution?
Okay. Maha Hussain from University of Michigan.
Okay. All right. So just first off, I've been asking everybody if there's any particular research they're looking forward to being presented at ASCO or anything in particular in terms of the conference.
I have to say I'm excited about multiple areas. Like anything else, I am really excited about the plenary session and all of the new clinical trials with the different new agents, specifically immune agents being presented. I think that's fantastic. I think from my end in GU oncology, which is my specialty area, the work in prostate cancer and the work in bladder and renal cancer in the oral sessions that will be presented also, again about the different new agents with really very exciting outcomes. So stay tuned, I guess. And
okay. So let's just start with the Stampede trial. Kind of what are your thoughts on that trial and potentially the impact that the findings can have?
I think what is great about Stampede is that the results of it essentially affirms what Charted found. In that adding chemotherapy, docetaxel, earlier in the course of the disease, long before the cancer becomes resistant to hormone treatment, in fact has a bigger sort of return on investment in terms of bigger survival advantage there. So I think from that perspective it's great. Obviously we have not seen the details of Stampede, and I'm looking forward to the formal presentation and certainly the details of the data, and to see if in fact, particularly in the metastatic patients, what are the characteristics of the patients that tended to benefit from the chemotherapy, because obviously in an era of personalized medicine and precision medicine, I think the concept of a one-size-fits-all approach has to end in prostate cancer, and we need to begin to define populations that benefit the most so that we can spare those who are not likely to benefit. So I'm excited and look forward to seeing the results. But to me, in my mind, it affirms the Charted data.
And then with that kind of personalized medicine approach, what do you think needs to be done to get to that place?
I think the way I look at it, I know there are different lingos that have been used, and we started decades ago when I was in training with sort of targeted therapy and then biologically targeted therapy. I think the principle is the same of precision medicine and personalized medicine. The intent is to tailor treatment to the individual. And in my mind, as a physician, the individual isn't just the tumor or one sort of milligram or one focus of a tumor, but rather the totality of the individual. And that starts from the general perspective of management of the cancer to the actual nature of the disease to providing the right services for the patient and their families. I think that we live in an era that's very exciting. I think that there's been exponential increase in terms of the agents we have, not just in prostate cancer, but in a variety of other cancers. And I can only see that progress will happen in much faster ways towards curing cancer. We used to think of an achievement as making the cancer chronic. I'd say right now, cure is what we should be shooting for. And I think precision and personalized medicine is one tool towards that goal.
Within prostate cancer, what particular therapies do you kind of see on the horizon having the most potential to get to that goal?
I think there are really several very interesting agents across multiple paths. Prostate cancer is in some way unique in that it has been predominantly hormonally dominant type cancer, with androgens and androgen receptor sort of being the focus of treatment. But as we have gotten to analyze the cancer and understand it better, what is clear is that there are multiple potential areas to hit the cancer. that is likely to give us a bigger impact for specific groups of patients. And ultimately, I would say the more exciting path to go once we identify the right drugs is to begin to put them together so that you have a multi-attack strategy. And so I would say the androgen receptor continues to be a focus, and drugs targeting that pathway are getting smarter and smarter drugs, and several of them are out there being tested. I think targeting the cancer cell's ability to repair itself, so the DNA repair inhibitors are also very exciting class of drugs. Drugs that interact with the tumor suppressor gene pathways, RB and such, are very exciting area. And I would say we should keep our mind open towards smarter chemotherapy potentially, and other potential pathways. So I do think that it's a very exciting time.
With so many new therapies coming on the market, is it difficult to sort of figure out which ones are for which patients, and is there any kind of biomarkers that you have been excited about to sort of help with that?
I would say it is difficult, and it isn't so difficult. After all, we're doctors, and it's much better to have tools to treat patients rather than the old days, including when I was in training in my early career, when we didn't have hardly anything to offer patients, and we had to kind of come up with stuff to treat our patients. So I would say there are again, multiple potential biomarkers that need to be examined. I'd say the prostate field especially, and I'd say GU in general, has been behind with regard to predictive biomarkers. And I do think that it is time that this is taken seriously. Myself and others, we've collaborated on different projects to try to precisely address this issue. And so we have multiple clinical trials that I've conducted in bladder cancer, and we're currently conducting in prostate cancer, where we're trying to pick up certain biomarkers that we think, based on science that's either homegrown from our translational scientists at Michigan or from other collaborators across the country, that would suggest that identifying a particular pathway and targeting it may actually be the best way to go. So that's what I would say is really the way for the future.
Kind of switching topics a little bit, you were picked as a giant of cancer care this year, correct? Just kind of wanted to get your comments on how you feel about that award and what it means to you.
Well, I actually was, my first reaction was seriously, and I was truly humbled and honored. Specifically because I'm only 5'2", so I couldn't see myself as being the giant, but I was really honored. And when I look at the other individuals that I am part of, I am very humbled, and I can tell you I was very excited to hear that. You know, we go in our careers not thinking about awards and rewards. We're really trying to help patients one person at a time. And so to get recognitions from colleagues is amazing.
That's all the questions.
Awesome. Is there anything else you want me to clarify in any of my answers?
I think you're okay.